Auranofin Capsule is used as part of a complete treatment program, including non-drug therapies, to treat active rheumatoid arthritis. It is specifically for patients with severe rheumatoid arthritis who have not responded to or cannot take other medications. Auranofin is a gold compound that is not a true pain reliever like aspirin, but it is thought to decrease pain associated with arthritis by reducing inflammation. It is known as a disease-modifying antirheumatic drug, DMARD, and can decrease morning stiffness, pain, and swelling in joints, as well as increase grip strength. Before you start taking Auranofin, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth, as directed by your doctor, usually once or twice a day. The dosage will depend on your medical condition and response to treatment. Your doctor may start you at a low dose and slowly increase it to minimize side effects. Take it regularly at the same time each day to get the most benefit. If you have been receiving gold injections, you can start taking Auranofin by mouth as soon as you stop the injections. If you are switching from penicillamine, wait 1 month before starting Auranofin. It may take 3 to 4 months of therapy before you see the full benefits of this medication. If your condition lasts or gets worse, be sure to inform your doctor. Some common side effects of Auranofin capsule may include diarrhea, frequent/loose stools, stomach/abdominal cramping, nausea, loss of appetite, heartburn, and headache. However, many people using this medication do not have serious side effects. It's important to tell your doctor right away if you experience any serious side effects, such as eye redness/pain, hair loss, numbness/tingling of arms/legs, signs of low blood count, easy bleeding/bruising, black/bloody stools, cough that doesn't go away, mucus/pus/blood in watery diarrhea, dizziness, signs of infection, severe stomach/abdominal pain, change in the amount/color of urine, vomit that looks like coffee grounds, or yellowing of eyes/skin. Auranofin may also cause mouth/lip/throat sores, stomatitis. If you notice a metallic taste in your mouth, this could be the first sign of stomatitis. Rinsing your mouth with a mild salt solution may provide some relief, but it's important to discuss this with your doctor. While a very serious allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as itching/swelling, rash, severe dizziness, or trouble breathing. Auranofin can commonly cause a rash that is usually not serious, but it's important to get medical help right away if you develop any rash. Remember, this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. This medication can have serious, sometimes fatal, side effects. This includes diarrhea that doesn't go away, blood cell problems, like anemia, low white blood cells, or low platelets, kidney problems, rash, itching, or mouth sores/irritation. Having low white blood cells can increase your risk of infection. Your doctor will closely monitor certain lab tests, like white blood cells and platelets, before you start taking this medication and while you are taking it. It's important to keep all medical and lab appointments. Before taking Auranofin, it's important to let your doctor or pharmacist know if you have any allergies, especially to gold or heavy metal compounds. This medication may also contain inactive ingredients that could cause allergic reactions or other problems, so be sure to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, especially if you have had any reactions to gold compounds, bleeding problems, blood disorders, colitis or inflammatory bowel disease, eczema, kidney or liver disease, or systemic lupus erythematosus. Auranofin may make you more sensitive to the sun, so it's best to limit your time outdoors and avoid tanning booths and sun lamps. Using sunscreen and wearing protective clothing is recommended. If you experience sunburn or skin blisters/redness, be sure to tell your doctor right away. If you are planning to have surgery, it's important to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. For women, it's important to let your doctor know if you are pregnant or plan to become pregnant, as Auranofin may harm an unborn baby. If you become pregnant while using Auranofin, talk to your doctor about the risks and benefits of continuing this medication. Auranofin can also pass into breast milk and may have undesirable effects on a nursing infant, so be sure to consult your doctor before breastfeeding. Remember to check the How to Use section for more information. It's important to be aware that Auranofin capsule may interact with other medications, which could affect how well they work or increase the risk of serious side effects. This list may not cover all possible interactions, so it's essential to keep a record of all the products you use and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, this medication could interfere with certain lab tests, like the tuberculin skin test, potentially leading to false test results. It's important to inform lab personnel and all your doctors that you are taking this medication. If someone has taken too much Auranofin capsule and is experiencing severe symptoms like loss of consciousness or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center. It's important not to share this medication with others. While taking Auranofin capsule, it's important to have regular lab and/or medical tests done, such as a complete blood count, liver/kidney function tests, and urine tests. Make sure to keep all your medical and lab appointments. And if you have any questions about these tests, be sure to consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Make sure to store Auranofin capsules at room temperature, away from light and moisture. It's important to keep them out of reach of children and pets. When it comes to disposing of the medication, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company to properly discard the product when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.